Hello, hello. My name is Maria, and welcome to this special edition of our public health podcast called Lifting Up Lewis County. Today, we'll be joined by Samantha Ahrendt, Maria Kloeppel, and Sarah Wieberg, three public health nursing students here to tell us all about the health status of Lewis County and how we can improve it. Thank you for joining us, guys.
Of course, we're super happy to be here.
Yeah, very happy to be here.
So, ladies, tell us a little bit about Lewis County.
Well, Lewis County is located in northeast Missouri, covering 511 square miles, with just under 10,000 people living there. Lewis County has a predominantly white population, about 93%, so this rural region is pretty scarce of diversity. Lewis County's most populated towns are Canton, Ewing, LaGrange, Lewistown, and Monticello. As for the socioeconomic status of Lewis County, the average income is about $57,000, putting just about 18.6% of the population below the poverty line.
Oh, wow, interesting. Yeah, since I'm from St. Louis, that's crazy to hear that their population is under 10,000 people, because St. Louis has almost 30 times more people with a population of about 293,000. So I can't help but wonder what it's like seeking healthcare there.
Yeah, since Lewis County covers a large portion of land but yet still has a smaller population, it can be challenging to find health care, especially in an emergency, since the nearest hospitals are Hannibal Regional Hospital, which is about 30 minutes away, and Blessing Hospital in Quincy, Illinois, which is also, it can be like 30 minutes to an hour away, both of these hospitals, depending on where you're located in Lewis County.
Oh, okay. Yeah, I can see how that could interfere with a bunch of different health situations. And I'm thinking that the lack of population density could also make it difficult to deal with widespread health issues like heart disease and lung disease and stuff like that. Speaking of widespread health issues, Maria, what did you find to be the most concerning health issue in Lewis County?
Well, it seems like there's a significant presence of heart disease, but there's also a prevalence of lung cancer, stroke, diabetes, and other cerebrovascular diseases. In Lewis County, the Caucasian population rate of heart disease is currently at 244%, which is most likely due to the higher rates of high blood pressure, diabetes, obesity, and high cholesterol amongst Lewis County.
Wait, so why do the people in Lewis County have higher rates of those risk factors?
Well, Lewis County has higher rates of the presence of unhealthy lifestyle habits like smoking, physical inactivity, and low fruit and vegetable intake. It makes sense that this would be the case, though, because if you think about it, with grocery stores and non-fast food places being less accessible to the people of Lewis County, it's no wonder they eat less fruits and vegetables. And if we recognize their lack of population density, then we realize how that makes it harder to educate the people about healthy lifestyle habits, explaining why more people are still smoking and not exercising, because they don't quite realize how unhealthy it really is.
Wow, that is very insightful. So, how do you plan to address this issue?
So our vision is kind of to hopefully improve Lewis County's overall health, is to mainly educate and promote lifelong behaviors that will prevent and decrease the risk of heart disease. Our goal is to implement heart-healthy habits and behaviors within the younger age groups in Lewis County to hopefully increase the healthy behaviors, which will then decrease precipitating factors that can increase the risk for heart disease at an older age.
Oh, that is such a good idea. I never thought of it like that in a primary prevention type of way.
Yeah, prevention is definitely the key to healthier living, and that's why it's our goal to implement different health promotion programs within the younger age groups, like by working with the two school districts, Highland and Canton, and with the Culver Stockton College. However, heart disease is still a major issue in those of the older population, and it is our goal to prevent the continuation of unhealthy heart habits. This will lessen the progression of heart disease amongst adults in Lewis County.
Yeah, that totally makes sense. And that's really cool that you're going to work to create a culture of heart-healthy behavior in Lewis County by implementing these programs to promote regular exercise and proper dietary habits, and to promote screenings for risk of heart disease too. So, Sarah, I'm wondering, why specifically do you think this is going to work? Like, is there any sort of evidence-based reasoning behind your guys' plan?
Yeah, we're nursing majors, so of course there is. All of our teachers are always encouraging us to find evidence-based reasoning for all of our research. So according to the National Library of Medicine, aerobic exercise has favorable effects on lipid metabolism, cardiac remodeling, post-MI heart failure, insulin resistance, and endothelial function. They also teach us that 30 minutes of exercise 5 times a week can improve insulin sensitivity and blood glucose control. Lower overall blood pressure, improves antithrombotic platelet regulation, activation of leptin hormone, and reduces age-related mitochondrial damage. And it also regulates antioxidant defense, all of which can help to reduce the risk for cardiovascular disease.
Wow. So I guess I need to start exercising more often. I knew exercise was important, but I didn't understand how it could affect my body so much and increase my risk for health issues. No one has ever explained it down to the cellular level like that to me before.
Same. I'm glad we both realize that now. Another thing I wanted to talk about was how the Center for Disease Control recommends at least 30 minutes of physical activity each day for 5 days a week. So we really would like to make this more attainable for the individuals in Lewis County. We wanted to create a low-cost or free exercise program for the adults that will be offered in Lewistown, Canton, and LaGrange to encourage routine and community through exercise. Additionally, we would like to re-implement the jump rope for heart in the school districts to promote consistent exercise in our adolescent population. The program not only encourages youth to exercise in an engaging way, but it also helps to raise awareness and funds for the American Heart Association to further the reduction of heart disease in America. In order to create lifelong habits, we believe that targeting the younger population will encourage these routines to start at a young age and be carried on into adulthood.
Wow, that sounds like it would be such an amazing opportunity for the people of Lewis County. And me personally, I have a special love for pediatrics, so I love that you are helping the younger population. But I do have a question for Sam. Is there anything else you would like to say to the people of Lewis County directly before we have to go?
Yes, actually, I think it's super important to touch on the lack of access to healthy food options in Lewis County. We did do some research on affordable healthy foods that we would like to share. There have been several studies, one of which includes a clinician's guide to healthy eating for cardiovascular disease prevention, that have examined nutrient properties of certain foods with food price analysis that have shown that milk, yogurt, carrots, cabbage, and non-sweet whole grain cereals and oatmeals, which all offer high nutrient density at low cost, as do many low sodium canned and frozen foods as well. There are also affordable non-starchy frozen vegetables such as cauliflower, rice, and zucchini spirals that may substitute starchy foods such as the rice and the pasta and like the white potatoes that a lot of us eat very commonly. Also, evidence-based practice has found that there is not a one-size-fits-all heart-healthy diet that can be applied to every single member of the community, especially in situations in which there are barriers to dietary modification. What really matters is that we utilize a shared decision-making strategy in order to find healthy and sustainable alternatives to dietary modification, in which the patient can adhere to. Lastly, I want to touch on and ask the people of Lewis County to listen up, because we will also hold informational booths at the local grocery stores to provide nutritional education to families on one Saturday a month.
That is such a great idea to help educate the people of Lewis County about heart-healthy diets. With your guys' plan, it seems like you're going to do a great job working together to address the health issues and lower the rates of heart disease amongst Lewis County. Well, thank you guys so much for being here. I had a great time. I think that's all we have for today.
No problem. It is our duty as future healthcare workers to help spread the knowledge of how to have a healthy lifestyle to both younger and older populations, whether that be through teaching proper eating habits or ways to get frequent exercise. We are happy to have joined you today to share this information.
Yes, as a future healthcare worker myself, I agree. It's been great talking with you guys. It's been great lifting up Lewis County. Listeners, thank you for being here as well for this special edition of the Public Health Podcast. See you guys next time.